My name is Paul Michael, and I'm a medical herbalist at Health Matters in London. I also practice something called Endobiogenic Medicine, and I wanted to take some time today to talk to you about endobiogenic medicine and what it is. Now, it's a system of medicine that was developed to target, treat, and help prevent disease. It was developed by two eminent French doctors, Dr. Durafort and Dr. Lapraz, over a lifetime of medical research. Now, from the onset, they chose to use plant medicines due to their complexity of the plant medicines and the complexity of the human body. They felt that they perfectly match, and it's a great treatment modality. Now, endobiogenic medicine centers around the role of the hormonal system, the endocrine system, as the true manager of the body. We call it the true manager of the body because it's the only system which manages itself and all of the other systems in the body. Now, the hormonal system with the autonomic nervous system set the terrain for the individual. Now, when we talk about terrain, we talk about the environment of that person within and why they are susceptible to certain conditions. And a very good way of looking at the individual's terrain is to do a special blood analysis developed by these doctors called a functional biology. Now, this blood analysis looks at over 150 markers, and it's completely different to any other kind of blood analysis used. For example, if you had a blood test in the hospital and they looked at your hormone levels, they're only looking at the levels circulating in the bloodstream. But with this functional biology analysis, we're looking at how the cells respond to the hormones and the relative activity between each of them. And we need to look at the whole picture, really. So we look at all of these blood analysis, and we put that together, and we try to understand what's happening with that individual and what their individual terrain may be, so that we can choose plant medicines and sometimes supplements to better treat the individual. A good analogy is if we look at a house which is full of mold all over the walls in the house. If you use a anti-fungal agent and you just spray it on the wall and clean the mold off the wall or redecorate, then most commonly the mold will regrow. And that's because we haven't addressed the underlying factors that have allowed the mold to exist and to grow in that house. And if you work on the deeper level, you will be addressing the factors such as the the dampness in the house. So you might fit an extractor fan in the kitchen to get rid of the moisture when you cook. You might stop drying your clothes on the radiators, which will put extra moisture in the house. Fit a ventilation system, extractor fans, and so on. So at that level, you're modifying the environment of the house, and so the mold spores cannot find a home to live and to breed. And this is exactly what we're really trying to do with endobiogenic medicine. If you take patients with recurrent cystitis, in those individuals, the bacteria has found a suitable home to live, and they keep presenting with recurrent cystitis. So if you modify the environment of the individual in a positive way by working on the hormonal system, the endocrine system, and the autonomic nervous system, and you modify the environment, then the bacteria can't find a home to live and they just die off. So this applies to all kinds of illnesses, autoimmune diseases, and so on and so on. Not just infectious diseases like infections from bacteria, viruses, fungus, so on. So really that is the concept of endobiogenic medicine. And that's what I wanted to talk to you about today, and I hope that helps. And also, if you'd like more information, please go to the website www.healthmatterslondon.co.uk, and there are some articles on there, and there is also a page on Endobiogenic Medicine, and hopefully that will give you more information. Thank you for listening, and have a good day.